Guys, I welcome you all. So today we will be understanding about some important confusing terminology used in the orthopaedics, like related to the spine, like spondylolysis. What is spondylosis? Sorry, my mistake. It is spondylosis. What is spondylitis? What is spondylolysis? And what is spondylolisthesis? And what is spondyloptosis? So spondylolysis, it is as you commonly heard the term cervical spondylosis, which is commonly complained by your grandparents. So it is a degenerative findings seen in the adjacent vertebral end plates because of a age-related skeletal changes or some osteophytes formations as a part of a degenerative changes, repetitive wear and tears. You understand? This is your vertebral, and this is your vertebral end plate, which is cartilaginous in nature, which is made up of a hyaline cartilage. So when this undergo a damage, maybe because of some changes takes place inside the cartilaginous, remodeling happens, hyaluronic acids or maybe some osteophytes are formed. These osteophytes, when do the rubbing, they can rupture this cartilaginous plate, and eventually the pain arises. So it is a spondylolysis. So it is a degenerative age related thing. It is a spondylosis. Now spondylitis, it is an inflammation of the vertebrae, like the vertebrae are inflamed all over. There may be some infectious things and other. Now comes the important thing which I made this video for. What is spondylolysis? So as the word say, lysis means a breakdown, and this breakdown happens because of a repeated stress or some defect lies in the pars interarticularis of the vertebral arch. Now the question arises, what is pars interarticularis? The pars interarticularis, it is a, as the word say, interarticularis. So it is present between the two articular thing. The two articular thing in the vertebrae is your superior and inferior articular facets. So it is a narrow thin bridge of a bone present between the superior and inferior articular facet. The important of this is that it connect the posterior part, the pedicels, to the anterior one. That's why, and it bears the significant stress. That's why it's prone to injury. If you understand it with the diagram, so this is your vertebral body. You are seeing it from the posterior side. It is your spinous process, superior articular facet, inferior articular facet, and in between you have a pars interarticularis. This pars interarticularis connecting it. So when this has some stress over it, now in which condition there will be a more stress on this pars interarticularis? You have to understand a situation. Suppose a gymnast, mostly it is seen in as a is describing a systemic type of the spondylolisthesis. So the pars interarticularis has a repeated load when the patient undergo a hyperextension, because when the patient undergo an hyperextension, there will be a chance that the vertebrae is slipping over each other on the anterior side. Now to prevent this anterior slippage, posteriorly we have this pars interarticularis which is holding on it to prevent the thing. So there will be more stress on the pars interarticularis to prevent this anterior displacement or the forward displacement of the vertebrae. So when the patient do this repetitively, like you see in a gymnastic persons, they do it more often. So as compared to the hyperflexion injury, it is more common in the hyperextension injury. Understand? So once this happen, there will be a fracture over it, and this is known as spondylolysis, breakdown of the pars interarticularis. And usually this is without a displacement, but once it happens to at a level that it involves both the posterior, both the pars interarticularis, so there will be instability, and because of that there will be on doing a hyperextension of the back, there will be a forward displacement, because there is nothing on the posterior side to prevent this displacement. and this is known as spondylolisthesis. So it is commonly seen, it is known as end result of the spondylolysis, means a displacement of the one segment of a spine over the another spine, anterior displacement. And there is a radiological grading system for that how much displaced, based on how much it is displaced, there is a Meiringen classification. Suppose this is your vertebrae, this is your two vertebrae, two adjacent one, so it is anteriorly displacing. So how much it involving, suppose if it's involving 0 to 25%, it is grade 1, grade 2 26 to 50%, grade 3 51 to 75%, grade 4 when it's 75 to 100%, and when it's become more than 100%, like this, you can understand the scene like this, more than 100% it goes, then this is known as a spondyloptosis, means there is a complete anterior displacement of the one vertebrae over the next. So I hope you understand the difference between these things. There's another diagram explaining the structure of pars interarticularis, this, and if you read it about in a detail in a textbook, that this thing is represented on X-ray by similar to a Scottish dog appearance. Like normally on a normal lumbar vertebrae, a Scottish dog appearance is seen. So suppose this is like this, and this image is taken from the Radiopedia site. You can go and refer it. I'm explaining in a brief. Like first, this is your transverse process, second is your pedicels, third is your superior facet, sixth is your inferior facet. The one which is connecting these superior and inferior facet is what? Pars interarticularis. Yeah, this is fifth is lamina, and seventh is your spinous process projecting posteriorly, and eighth is your interlaminar space, and ninth it is intervertebral disc, and this giving you an appearance of a dog. So when you have, it is a normal thing, remember, when you are seeing appearance of a dog normally, that it's a normal sign. But when you see a break in his neck, looks like a Scottish dog bearing a band of collar around his neck, it means that there is a fracture of pars interarticularis, and this is known as what, as we have read, this is known as a spondylolysis. You understand? So yeah, that's all for today's video, and thank you all. I hope you never, from the next time you will never confuse between these confusing terms.